Aqsusten 25. Solution for injection is a natural female hormone that helps regulate ovulation and menstruation. It is used to restore menstrual cycles in women who have stopped having periods and to treat infertility. A healthcare professional usually gives Aqsusten 25 solution for injection, so it should not be self-administered at home. Follow your doctor's instructions on how to use it. Do not use more or less than prescribed, and do not use it for longer than recommended. You may need to continue taking this medicine even after becoming pregnant. Common side effects include abdominal cramps, back pain, breast tenderness, low blood pressure, dizziness, increased risk of blood clots, and vaginal bleeding. Your doctor may suggest ways to reduce or prevent these effects. Occasionally, it can cause a severe allergic reaction that needs urgent medical attention. Tell your doctor if you have a history of breast cancer, unusual vaginal bleeding, or any liver, kidney, or heart diseases. Also, inform your doctor about any other medications you are taking, as they may interact with this medicine. You will likely need several tests before and during treatment with Aqsusten 25 solution for injection. This medicine can affect your thinking or reactions, and you may feel very tired, so be cautious when driving or doing anything that requires you to be alert.